Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on the impact of cancer treatment on bone health and the benefits of exercise. Following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Bones provide the framework of the body, providing structure, support, and protection for your internal organs. For example, your rib cage protects your heart and your lungs, and the spine supports your trunk of the body and allows for an upright position. It works with your muscles to create movement, and it stores calcium and other minerals, along with containing bone marrow, which is where blood cells are made. Did you know that after our mid-30s, bone density gradually decreases as we age? This occurs because osteoclasts break down bone tissue at a faster rate than osteoblasts can rebuild it, leading to bone loss. Risk factors for bone loss include age, genetics. Women are at highest risk regardless of whether they've had cancer. This is because bone loss usually happens after menopause. Certain medical conditions, lifestyle choices such as sedentary behavior, cigarette smoking, excessive alcohol consumption, inadequate calcium and vitamin D intake, along with low levels of testosterone or estrogen. Bone diseases are conditions that affect the strength, structure, and development of bones. Osteopenia is a condition where bone mineral density is lower than normal, increasing the risk of fractures and potentially progressing to osteoporosis. Osteoporosis is a condition where bones become weak and brittle, increasing the risk of fractures, often developing silently until a fracture occurs. Cancer treatments, while necessary for controlling tumor growth and preventing recurrence, can have significant negative effects on bone health. These treatments disrupt normal bone remodeling, increase bone resorption, and reduce bone formation, leading to osteopenia, osteoporosis, and increased fracture risk. In the next slides, I will break down how different cancers impact bone health. Chemotherapy slows bone growth by damaging bone-building cells. This means that bones won't be able to rebuild fast enough, leading to weaker bones over time. It lowers estrogen and testosterone levels, which are important for keeping bones strong, and it also causes calcium, vitamin D, and protein deficiencies, which is needed to keep bones healthy. And many patients are on steroids to reduce inflammation or nausea. Steroids can stop bone-building cells from working and making bones break down faster. And women who are on chemotherapy can be put into chemo-induced menopause. Radiation therapy kills bone-building cells. It slows new bone formation while bone-breaking cells survive longer, causing more bone loss. It reduces blood flow to bones, making them more fragile or at a higher risk of fractures, and bone death can occur in the jaw or spine, leading to severe pain and bone damage. Hormone therapy works by blocking or reducing the growth of hormone-sensitive cancer cells. Hormone therapies such as aromatase inhibitors are used in hormone-positive breast cancers to reduce estrogen levels, which can significantly lower bone metabolism. Androgen deprivation therapy is used to treat prostate cancer, and it is designed to reduce testosterone levels and slow cancer growth. Patients using hormone therapy have a significantly higher risk of osteoporosis or increased risk of fractures, especially in weight-bearing bones such as the spine, hips, or wrist. And in postmenopausal women who already have lower estrogen levels, studies have shown that bone mineral density declines by 2 to 3% in aromatase inhibitor users. And even after stopping treatment, bone density may not fully recover. So taking early intervention and making bone health monitoring crucial because it can contribute to long-term skeletal fragility and significantly impact quality of life. Someone who has bone metastases has an increased risk of skeletal fractures, spinal compressions, and exacerbation of bone pain. Exercise programming should avoid high-impact movements, trunk bending or twisting, or any loaded spinal motions, and bone pain should be monitored during and after exercise. The goal with exercise is to preserve bone mineral density while preventing fractures while also managing fatigue. Exercise to improve bone strength are site-specific. For example, walking improves bone strength in legs and spine, but not the wrist. There are two types of exercise recommendations that I will talk about today. The first one being weight-bearing exercises. This is any activity you do on your feet that works your bones and muscles against gravity. For example, brisk walking, jogging, running or hiking, jumping rope, any team sport such as tennis, pickleball, or basketball, and stair climbing. Something you should know is that the higher the impact, the more bone strengthening benefit there is. Strength training is when resistance is added to movement in order to make muscles work, and over time, they become stronger. They put stress on bones and have a bone building capacity. For example, using weight machines, free weights or dumbbells, elastic resistance bands, or bodyweight exercises. And it should be noted that people who are frail or who already have been diagnosed with osteoporosis, osteopenia, should talk with their doctors about the types of physical activity that would be best for them. Thank you so much for being a part of our conversation today on cancer, bone health, and the benefits of exercise. I hope the information we've covered has brought you some clarity and comfort. Your health and well-being are what matters most, so please continue to take care of yourself, stay informed, and remember that hope is always present. Now let's transition into some gentle movement to further support your journey.
Hi, I'm Vanessa, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to week 6 of our 12-week seated strength training program. The goal of this program is to help you regain strength, increase your physical function, and improve your overall well-being. This week, you will need a stable chair and a set of lightweight dumbbells or objects you have at home. The following exercises are meant to be pain-free. If you experience any pain from these movements, please skip the movement or stay in a pain-free range of motion. Let's get started. All right, let's begin with a warm-up. We are going to start with our hands on our chest. We're going to take a deep breath in, arms out to the side, and deep breath out. Hands back in. That's 2, 3, 4, last one, 5. All right, let's do some shoulder shrugs. Bring them up and squeeze. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, arms out to the sides. Let's do some arm circles forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's do big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. We're going to go backwards now. Small. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And big. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, let's scoot to the edge of our seat, stretch out our lower body a little bit, extend both legs out in front of you, toes up to the ceiling, and reach down. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Sit back up. Bend your left knee and then go ahead and cross your right leg over top for a figure 4. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Switch. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Go ahead and switch again. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. One more time on the left side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right. Now that we're all warmed up, let's move into the resistance part of our workout. Go ahead and grab your dumbbells. The first exercise we're going to do is chest flies. So scoot to the edge of your chair, and if you have a chair that has a back to it, we're going to go ahead and recline back. So rest the top of your back against the back of the chair. We're going to have dumbbells out in front of us, just straight out from our chest. Hands together, have a small bend in your elbows. We're going to bring them out to the side, right about just out to your shoulders, and then back out in front of you. And if you have a chair that doesn't have a back to it, you can just sit straight up here and do them just like this. All right, we're going to do 3 sets of 10. So go ahead and get into position. Arms out in front of you. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, go ahead and relax. Set those dumbbells down. Roll out your shoulders a little bit more if you need to. All right, we have 2 more sets of those. Go ahead and get into position when you're ready. Arms out in front of you. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Awesome. Go ahead and relax. Set your dumbbells down. Take a deep breath. Get a drink of water. We have 1 more set of those before we move on to the next exercise. All right. When you're ready, grab those dumbbells again. Lean back. Arms out in front. And 1, 2, 3. You should feel a good stretch in your chest here. 4, 5, 6, 7, 8, 9, and 10. Great job. Go ahead and set the dumbbells down. Relax for a second before we move on to the next exercise. This one is going to be bird dogs. So you have the option to use a weight here if you would like. I'm going to set mine down and go unweighted for now. If you decide that you want to pick up your weights after the first set, or if you start with weights and don't want to use them anymore, that's also fine. We're going to have knees bent, arms out in front of us, just like this, palms facing each other. We're going to extend our right arm above our head at the same time as we kick our left leg out. So it's going to be opposite sides from each other, just like that. All right, we're going to do 3 sets of 20 total, so 10 on each side. If you want to use weights, you can just hold your dumbbells in your hands right here. All right, when you're ready, 1, 2, 3. Keep your core nice and tight. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Great job. Go ahead and relax for a second. Set your dumbbells down if you were using them. Take a deep breath. Don't forget, you can always pause in between exercises if you need a little bit of a longer rest than I'm giving. No worries at all. All right. Arms out in front of us. Pick up your dumbbells if you would like to use them. And 1, 2, 3. Keep your core nice and tight. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Great job. All right, shake your arms out a little, shake your legs out. Let's take a deep breath. All right, we have one more set of those. Okay, if you want to challenge yourself for this last set, let's go ahead and use the weights if you can. No worries if you feel like you're not ready yet, that's totally fine. Arms out in front of us. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Great job. All right, set those dumbbells down. We won't need to use them for this next exercise. Take a deep breath, take a little rest. Before we move on, this next one is going to be seated jumping jacks. So we won't actually be jumping, but we're going to do the motion of a jumping jack. So we're going to have hands down by our sides, feet are together, and we're going to bring our arms out, legs out, and back in. Just like we'd be doing a jumping jack if we were standing up. We're going to do 3 sets of 15 of these. We're going to do them pretty slow. We're not going to go super fast, but we are going to get your heart rate up a little bit. All right, arms down by your sides. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Great job. All right, hopefully those weren't too tough for you. Take a deep breath. We have 2 more sets of those. All right, arms down by your sides. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Great job. All right. One more set of those. Get some water if you need it. All right. Last set, hands down by your sides. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. All right, awesome job. Okay, so we're not going to need our dumbbells again for this next exercise. It's going to be calf raises, but we're going to do them a little different than usual. We're going to have our hands on top of our legs, and we're going to use our hands for some resistance. So as we push up on our toes for the calf raise, we're going to use our hands to press down on our legs to give some resistance. All right, we're going to do 3 sets of 20 of these. If you'd like to use a dumbbell instead of pushing down with your hands, if that's too difficult, that's totally fine, or you can just do regular calf raises. All right, when you're ready, 1, 2, 3, squeeze at the top, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right. Relax for a second. Shake your legs out a little bit. Get some water. Wipe your sweat away if you need to. We have 2 more sets of those. All right, sit up nice and tall. Hands right at our knees. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. All right. 1 more set. Roll your ankles out a little bit if you need to. In between, take a little rest. 1 more time doing those. Sit up nice and tall, hands right on your knees. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Great job. All right, we're going to move back to our upper body a little bit. Go ahead and grab your dumbbells. And this exercise is going to be hammer curls. So I'm going to scoot to the edge of my seat so that my hands can be right down by my sides. So this is going to be working our biceps. We're going to have our elbows tucked right into our sides. And instead of a typical bicep curl where you would have your palm facing your body, we're going to curl up and our palms are going to stay facing in towards each other. We're going to tap the dumbbells up to our shoulders, squeezing at the top and bringing them back down. We're going to do 3 sets of 12 of these. When you're ready, 1, nice and slow, 2, 3, 4, squeeze your bicep at the top, 5, 6, 7, 8, 9, 10, 11, and 12. All right, go ahead and relax. Set the dumbbells down, shake your arms out a little bit. Get some water if you need it. We're gonna do 2 more sets of these. Go ahead and get into position, elbows are tucked in, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, one more, and 12. Great job. You should be feeling the burn in those biceps. All right, one more set of these, then we'll move on to our last exercise before our cool down. I believe in you, you've got it. Hands down by your sides, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Great job. Let's set the dumbbells down. We are all done with them for the rest of this exercise. We're going to finish up with a lower body exercise. We're going to do some hamstring curls. So sit up nice and tall. We're going to do right leg out in front of us, extended straight out. We're going to curl it in, bring your foot underneath your chair like you're kicking your bottom, squeezing that hamstring muscle, and extending back out. We're going to do 3 sets of 10 on each side. We'll do one side at a time. Go ahead and start with your right leg out, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. Extend the left leg out. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. Go ahead and relax now. Get some water. Let's take a deep breath. All right, 2 more sets before we can move into our cool down. All right, right leg out in front of us, and 1, 2, 3. Focus on that hamstring. This is 5, 6, 7, 8, 9, and 10. Good. Move it to your left side with as little of a break as you can. This is 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. All right, we have one more set of these of our last exercise. I know you can do it. I know you're ready to be done. All right, go ahead and extend that right leg out. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Switch to the left side. 1, 2, 3, 4, 5, 6, 7, 8, almost there, 9, and 10. Awesome job. All right. Let's go ahead and move into our cool down. Let's do some shoulder rolls. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Go the opposite way. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Go ahead and turn your head to the right side. 1, 2, 3, 4, 5. Over to the left. 1, 2, 3, 4, 5. Back to the right. 1, 2, 3, 4, 5. To the left one more time. 1, 2, 3, 4, and 5. All right, let's do some cat-cows on our own. So cat, we're going to round our back. Cow, we're going to push our chest forward. Let's just go ahead and do a few of these. Make sure you're breathing. Get a good stretch in your back. Let's do one more on our own. All right. Let's go ahead. Rotate to the side. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, and 5. All right, great job today. Thank you so much for joining me for week 6 of this seated strength program, and I will see you next week.